There is a popular saying, health is wealth. Today on Health, we're joined by Dr. Favor Ayewole. She'll be discussing the risk factors, symptoms, preventions, and of course, management of hypertension and diabetes. Hello, and welcome back to Wake Up Nigeria. How are you doing today?
Thank you. I'm fine. Good morning.
Okay, now, so you're so young for a doctor, I must say that. you know, medicine literally takes like 8 to 10 years to complete.
Yeah, well, medicine is actually supposed to be like 6 years
6
or
years.
plus, but yeah.
You factor in Nigeria into federal schools.
Yeah.
Anyway, so today we're talking about hypertension and diabetes. Now, I want to ask this question before we even go in. Why are we even having them side by side in the first place?
Yeah, we have hypertension and diabetes side by side because when we see, okay, so the risk factors for hypertension and diabetes, they have some similar risk factors.
Okay.
And someone that has diabetes is also likely to have hypertension. Someone that has hypertension is likely to have diabetes.
Likely to, okay.
Yes, so like that's why we're talking about both of them together.
Together. Okay, so now let's talk about these risk factors. So what are these risk factors? Now tell us first of all the similar risk factors with both of them, then the separate ones.
Okay, so the similar risk factors, include genetics. So if a family member has it, especially like your mom, your dad, a sister, twin, that person is likely to have diabetes or hypertension.
Okay.
Also, obesity, being overweight, you're likely to have both of them. Also, older age group, as you grow older, from 40 years upwards, person is likely to have them. Like the risk factors, it increases.
It increases.
Not that you're going to have it. So yeah, those are okay. Physical inactivity too. So like someone that sit down for most of their day, doesn't move about and all that. Yeah.
So we know. I think over the years I've heard of how diets can affect hypertension or diabetes. I mean, diabetes, we talk about a lot of them, sugar intake and all of that. I think for hypertension, we talk about a lot of salt intake, right?
Yeah.
So how does that affect these things? So now, can we talk about, is it possible that can someone just have diabetes because of the sugar intake? Or is it possible that maybe there's a lingering history somewhere that maybe the food now triggers?
Okay, so you don't just have diabetes because of sugar intake. There's like a lot of factors to be considered.
Okay.
Like I said, maybe the person had the gene, the person had there are some other causes, there are some other diseases that produce that those genes or those things that are responsible for high intake, like for high sugar in the body. And also, what we don't know is that it's not just refined sugar that we take that increases the risk factor. Even our carbohydrates, your rice, your beans, every other carbohydrate, yam and all that. Also, they all come down to blood sugar. So people just focus on refined sugar, Coke, and all that, and then they take other things in large quantity.
Oh, wow.
So all that too can increase. So it's not just the sugar that we see, but other carbohydrates.
All right, now I think that's actually something we've learned for today, that, okay, fine, we're talking about diabetes, high sugar intake, whether refined or unrefined. So I think in all summary, we should just probably be moderate with everything we take and all of that. Sadly, we actually have to go. That's all we have to take an interview right now. We're short in time. But then again, you're here again next week. So we will continue this conversation. Thank you so much for coming. And that's it right here on this conversation. We have to go on a break now, but we'll be right back.